Hi there, welcome to this topic on the functional approach to COVID-19, the benefits of nutraceuticals and botanicals. My name is Ashley Anderson, registered dietitian, personal trainer, and owner of Move Fully Nourished, where we specialize in nutrition and exercise coaching using an integrative approach to help active adults achieve optimal health, healing the mind, body, and spirit. Our integrative approach is designed to empower you as well as transform your lifestyle and relationship with food forever. Now, I've done videos in the past about the things that you can do to really help improve your immunity and to help prevent the contraction of COVID-19. But with this presentation, I really wanted to focus on the nutraceuticals and botanicals that can really make a big difference and help supplement and support the nutrition and lifestyle changes that you are making. This information is also presented from the Institute of Functional Medicine and their functional medicine approach to COVID-19. So my discussion today is going to be centered around the preventative approaches in therapeutic interventions using nutraceuticals and botanicals, and emphasizing the safety, validity, and effectiveness of each supplement that's backed by research from the Institute of Functional Medicine, or IFM. If you want to learn more about the nutrition and lifestyle preventative interventions to improve your immunity, you can search How to Strengthen Your Immune System with Move Fully Nourished on YouTube, and you can watch that 6-minute video. It's short and sweet, but appropriate for the time that we're going through. So why is it so important to personalize a therapeutic approach and the agents that support a healthy immune system? Well, it's important to have a healthcare provider, first and foremost, who is going to be on your team when it comes to supporting you with the most up-to-date research and the most natural approaches that are individualized to you. So please take the information that I give to you today to your functional dietitian or doctor to make sure that there are no contraindications for introducing any of the supplements I'm discussing, as well as understanding which ones are most appropriate for you, as you do not need to take all of these nutraceuticals and botanicals that I'm going to talk about in this video. First, I want to mention the overarching benefits of taking some of these supplements. And again, let me say that the term supplement is exactly what it sounds like. It's meant to supplement or support a healthy diet and lifestyle, not the other way around. So the following supplements can help your cells repair and defend against foreign invaders, can help to modulate viral-induced pathological cellular processes, and promote viral infection eradication or inactivation, can promote resolution of collateral damage and restoration of cellular function, and may reduce the severity and duration of acute symptoms and complications due to COVID-19, while supporting recovery and reducing long-term disease or medical conditions. So let's start by discussing zinc. From the Institute of Functional Medicine, the quote, "Zinc contributes to immune defense by supporting various cellular functions of both the innate and the adaptive immune system. There's also evidence that it suppresses viral attachment and replication." So zinc deficiency is common, and especially in those populations that are most at risk for severe COVID-19 infections. And it's challenging to accurately diagnose with laboratory measures, but supplementation with zinc is supported by evidence that is both preventing viral infections and reducing the severity and duration. Also, it's been shown to reduce the risk of lowering respiratory infection, which may be out of particular significance, right, in the context of COVID-19. The suggested daily dose is 30 to 60 milligrams per day in divided doses. All right, let's next discuss elderberry as a supplement. Elderberry has been used historically as an antiviral herb and is most effective in the prevention of an early infection with respiratory viruses. The suggested dose is 500 milligrams once a day for up to 12 weeks maximum. Vitamin D is up next, and it's a steroid hormone and an immune system modulator that reduces the expression of inflammatory markers and increases the innate immune system's response. So the Institute of Functional Medicine's guidelines suggest that a laboratory range of about 50 to 80 nanograms per deciliter for the serum hydroxyvitamin D may help to mitigate more morbidity from COVID-19 infection, and in general be a more optimal range for vitamin D levels for bone health and neurological function, mood regulation. And at Move Fully Nourished, we always ask our clients to request from their doctors to order a blood draw for vitamin D, or we order the panel ourselves to determine the individual's appropriate dose for the optimal range. Many times based on location or where the client lives or their exposure to sunlight or lack thereof, the dose is commonly 5,000 IUs one time a day. The second vitamin I want to discuss is vitamin A. So vitamin A is a micronutrient that is crucial for maintaining vision, promoting growth and development, and protecting the epithelium and mucus integrity in the body. And vitamin A is also known as an anti-inflammatory vitamin because of its critical role in enhancing immune function. Vitamin A is involved in the development of the immune system and plays regulatory roles in cellular immune responses and hormonal immune processes. The suggested dose from the Institute of Functional Medicine is 10,000 IUs per day, but be careful with upper levels of vitamin A intake ranges of 25,000 IUs because you can overdose, especially if you are pregnant. You don't want to go too high of a dose because you can really disturb the development of the embryo or fetus. And then quoted from the IFM, vitamin C contributes to immune defense by supporting various cellular functions of both the innate and, again, adaptive immune systems. Supplementation with vitamin C appears to be able to both prevent and treat respiratory and systemic infections. Vitamin C has also been used in hospital ICUs to treat COVID-19 infections, end quote, and the suggested dose is 1 to 3 grams daily. The next supplement you may never have heard of, shorthand it's called NAC, which stands for N-acetylcysteine. NAC promotes glutathione production, which has been shown to be protective in rodents infections with influenza, helps to reduce colonization from progressing from illness to illness, and helps to modulate cellular defense and repair systems. So it supports cellular antioxidant defense system, aids in detoxification, promotes healthy lung function, and the suggested dose is 600 and 900 milligrams per day. All right, let's talk about quercetin. It's a powerful bioflavonoid that protects cells and the tissues against free radicals, which is a fancy way of saying inflammation. Quercetin also supports cellular, cardiometabolic, and immune health, and aids in viral healing. Suggested dose is 1 gram 2 times a day in capsules of 500 milligrams per day in liquid form with a fat for up to 12 weeks. And as an avid tea drinker, I love the idea of using herbs and tea infusions to promote health and reduce inflammation. And green tea in particular contains a component called EGCG. EGCG helps to reduce viral replication and prevents influenza. The suggested dose is 4 cups of green tea daily. If you have heard of the healing benefits of turmeric, then it's possible you've heard the word curcumin before because it is a component of the root itself. So curcumin has been shown to reduce viral replication, helps to reduce inflammation. It can be a powerful pain reliever, as strong as ibuprofen in certain doses. For our purposes, though, of this conversation, 500 to 1,000 milligrams 2 times a day of enhanced absorption curcumin, which means that curcumin is paired with a black pepper and a fat source. It is more bioavailable that way for the body to use. Okay, next up, melatonin's role in maintaining normal sleep-wake cycles is well known. Supplementation with melatonin is often needed to replace the body's declining production that may occur with increasing age. There's also been 2 recent published papers that propose the use of melatonin as a therapeutic agent in the treatment of patients with COVID-19 because it helps to modulate viral-induced pathological processes. Suggested doses by the IFM is 5 to 20 milligrams every day. Okay, let's dig into resveratrol next. Resveratrol is a naturally occurring polyphenol, so polyphenol coloring shows many beneficial health effects. And resveratrol is a component found in grapes, red grapes, and red wine. It's beneficial because of its antioxidant components and cardioprotectant properties. It promotes cardiovascular health through its antioxidant action and its ability to promote healthy platelet function and reduce inflammation. Again, suggested dose for helping to modify viral-induced pathological processes, again, is 100 to 150 milligrams daily. Now, this presentation today is only intended to inform you and to identify nutraceutical and botanical agents that may boost your immune system. It is not meant to treat COVID-19, nor am I promising that you won't become infected with this because in use with the supplements. None of these practices are intended to be used in lieu of other recommended treatments, because we always want you to consult your functional physician or healthcare provider prior to starting a new supplement regimen. And at Move Fully Nourished, we are here to help you take back your health and get to the root cause of your ailments, to have the best quality of life possible, to help you thrive, not just survive. And thanks so much for joining me until the end of this presentation. Please check out our blog at movefullynourished.com for more research-based information on nutrition and wellness. Thanks, and have a great rest of your day.